Hello and welcome. My name is Jamie. I am in the Outreach and Training Unit with the Washington State Healthcare Authority. The purpose of this recording is to provide general information over PEBB Retiree Health Insurance for the 2020 plan year to those individuals who are looking forward to retiring or separating employment in the near future. So what does PEBB stand for? PEBB. Well, it stands for Public Employees Benefits Board. It's a program that's administered by the Washington State Healthcare Authority, and it offers access to comprehensive health insurance to retiring public and school employees. So when we're talking about public employees, we're looking at state agencies, higher education institutions, employer groups who have also joined PEBB benefits, as well as SEB organizations, so K through 12 school districts, charter schools, and most educational service districts that are on the SEB program. So if you are under the PEBB or SEB program as an employee and you're eligible for benefits, then when you separate employment, PEBB retiree coverage is an option for you. But keep in mind that you do still have to be eligible for that coverage. And I'll talk more about eligibility later on. One important thing to note here is that you do have a one-time opportunity to enroll in or defer this coverage after you separate employment. And it's very important to know that in order to enroll or defer it, we do need to receive an enrollment form from you. The PEBB program must receive that enrollment form no later than 60 days after your coverage through your employer ends. So remember, 60 days, that's your window. When you separate employment and your insurance coverage ends, after that, you only have that 60-day window to submit your enrollment forms if you would like to enroll in this coverage. So what does PEBB retiree health insurance include? Well, it includes medical and dental insurance. Now keep in mind that the medical benefit does include the vision benefit, so they're sort of built in together. Under the medical plans, we do have options for preferred provider organizations or PPOs. PPOs are generally those plans that will allow you to self-refer. And then we also have managed care options. Those would be plans more like where you have to go and see your provider in order to be referred to a specialist. We also have medical plans available to you both before you are eligible for Medicare as well as after you become eligible for Medicare. And PEBB retiree health insurance also includes a life insurance benefit as well that you have the option to elect. So where can you find more information? While I did state earlier that this is a general overview, we do have a lot of information available for you guys on our website. And especially right now with the current events, going online is definitely going to be your best resource. But you can also contact our retiree specialists for the PEBB retiree health insurance by calling 1-800-200-1004. Our website that I'm referencing here on this slide is www.hca.wa.gov/PEBB. Now you'll notice on this page that on the right-hand side we have the retiree section. It's circled here in orange with a little arrow next to it. That's where you're going to want to go to look for more information regarding PEBB retiree health insurance. But keep in mind, currently as an employee of either a PEBB program or the SEB program, you do have resources here for you as an employee as well. On the left-hand side toward the bottom here, there's a public employee tab. You can click there to learn more information about your employee benefits under PEBB, or in the middle we have school employees. So those are our SEB organizations, the K through 12 school districts and charter schools and ESDs. Those employees can find information here. And of course, the retiree section on the right-hand side. And if you were to follow our website, this web link right here, and you scroll down a little bit further, you'll find information on continuation coverage as well. So COBRA, for example. All right, so let's talk a little bit about the things that we're going to cover through this presentation. So the first thing will be eligibility. I mentioned earlier that this coverage may be an option for you, but you still have to meet eligibility criteria. What are the insurance coverage options that are included in this program? We'll talk about premiums. How much is it going to cost you? That's a big one. We'll talk about enrollment and procedural requirements. We'll cover payment options, deferring coverage, when you can make changes, and I'll provide you with contact information. All right, first topic here, eligibility. So what are the requirements to be eligible for PEBB retiree coverage? Well, they're based off of your retirement systems plan. So if you are under Department of Retirement Systems Plans 1 and 2, or 1 or 2, I should say, so we're talking PERS, TERS, any of those DRS retirement plans 1 and 2. So for you guys, you must be vested and eligible to retire when your insurance coverage through your employer ends. So if you're leaving employment mid-June and your insurance coverage were to end June 30th, then at that point, you must be vested and eligible to retire. And starting first of the next month, you must immediately begin receiving your pension payment in order to be eligible for PEBB retiree coverage. So it's really important here for plans 1 and 2, you must be vested and eligible, and you must immediately begin receiving your pension payment in order to be eligible for PEBB Retiree Health Insurance. Now keep in mind, you still have that 60-day window, so when your coverage through your employer ends, you have no more than 60 days to submit your enrollment forms to us and let us know if you'd like to enroll or defer. And we'll talk a little bit more about deferring later on. Okay, so let's cover eligibility for those who are on Department of Retirement Systems Plans 3. Again, TERS, PERS, we're talking Plan 3 here. For you guys, you must be vested and eligible to retire when your insurance coverage through your employer ends, but you don't have to draw your pension. Currently, the minimum requirements to be vested and eligible under Plan 3 are age 55 with at least 10 years of service. Again, you do not have to draw your pension under Plan 3, but you must be eligible to do so. Again, you have that 60-day window, no more than 60 days to contact us, submit your enrollment forms after your insurance coverage through your employer ends. For those of you on higher ed retirement systems, you must be eligible to retire when your insurance coverage ends, but you'll want to talk to your benefits office to find out when you're going to be eligible to retire. Again, you guys also have that 60-day window. Let's talk a little bit about the COBRA Bridge. So what is COBRA? COBRA is an extension of your current employer's benefits that's paid by you and generally available for up to 18 months. So why am I talking about COBRA and what does this bridge have to do with it, right? Well, if you're separating employment and you've met your years of service requirement, but you haven't quite met that age requirement, when you separate, you can elect COBRA coverage, no more than 18 months in most cases, to bridge yourself to that age in which you're either eligible to retire or in which you plan to draw your pension, depending on your eligibility requirements. So know that you can elect COBRA for up to 18 months, enroll in this, and that will extend your eligibility for PEBB retiree coverage. If you have more questions on this, I highly suggest you contact our PEBB customer service specialist back at the office. I'll be providing that phone number for you guys again here toward the end of the presentation. Now, I've talked a little bit about that 60-day window and how you have to let us know, are you going to defer or enroll? But I didn't really explain what deferring was. So that's what this section is for. So when deferring enrollment, what you need to know is that is just putting your opportunity to come on to PEBB retiree coverage on hold so you can come back later. What's important to know is if you decide to defer this coverage, you must still be eligible to do so, and you can't just say, hey, I'm going to defer this, I'll talk to you guys in a few years or 10 years. We actually have to receive that enrollment form from you. On the enrollment form, it has a section where you will elect whether or not you're going to enroll or are you going to defer. And you have to submit that to us within that 60-day window. Now, when you complete that enrollment form. If you are electing to defer, you need to tell us why. What other coverage are you going to enroll in that is going to allow you to defer? And keep in mind that there are only certain types of coverages that you can defer for. So what are those coverages? Well, we have employer-based medical. So maybe you're going to separate employment with your PEBB or SEB employer, and you're going to go work somewhere else, like Boeing, for example. If they're going to offer you medical coverage, they are your employer, you're eligible for benefits, and you're enrolling in those, great. You can defer your PEBB retiree coverage for those employee benefits. Or what if you're separating employment, but your spouse is going to continue working and your spouse has employer coverage available and can cover you as a dependent? Great. You can defer for that as well. You can also defer if you are going to be enrolled in the PEBB or SEB programs as a dependent. If you have access to a federal retiree plan such as TRICARE that you'll be enrolled in, or the Civilian Health and Medical Program of the Department of Veterans Affairs, also known as CHAMP VA. You can defer if you are enrolled in Medicare Parts A and B and Medicaid, or for the Health Benefit Exchange. Now keep in mind, these are the options that will allow you to defer, but here's what you really need to know. When it comes time to return to the PEBB program and you come back to us and you say, hey, I'm ready to enroll, we're going to ask that you provide proof of continuous coverage that you were enrolled in one of these types of coverage the entire time you were gone. So if you have even a month break, you will be denied access to your PEBB retiree benefits. So it's very important to have proof of continuous coverage without a single month break. Now, let's say you defer this coverage and you go on one of these other coverages that's listed here on the slide. When one of these coverages ends, you again have your 60-day window to contact us. Provide us proof of that continuous coverage along with your enrollment form and any other documents that we require in order to then enroll in your PEBB retiree benefits. So regardless of when you're coming on board, you always have that 60-day window from when your other coverage ends. Now keep in mind that while you can defer and come back as many times as you would like for some of these coverages, for example, employer-based coverage, you can come back to PEBB retiree coverage and then defer that coverage to go back to work if you choose to, as many times as you like. But for a federal retiree plan such as TRICARE, the Health Benefit Exchange, or CHAMP VA, you can only defer your PEBB retiree coverage one time and return one time. You cannot go back and forth multiple times. And again, when this coverage ends, you have a 60-day window to let us know what your decision is. Are you going to enroll? All right, let's talk about your medical insurance options here. So know that the plan that you can enroll in is dependent upon your county of residence. So that's the way that your coverage works today for many of you. So we do have a resource available on our website where you can go out and you can look at medical plan availability based on your county of residence. It will tell you which plans are available to you, the same way it will tell you about your coverage today as an employee if you were to visit that website. So a couple of ways you can find out which plans are available. The website that I referenced earlier, the section there for the medical plans available by county, and if you have the 2020 Retiree Enrollment Guide, that has a list inside of it of medical plan availability as well. So who can you bring on to your PEBB retiree coverage with you? You can bring your eligible dependents. The same dependents that you have enrolled with you today could be enrolled in your PEBB retiree coverage as long as they remain eligible. So we have the legal spouse, Washington State registered domestic partners, children up to the age of 26, extended dependents, and disabled dependents. Keep in mind that if you are adding a dependent to your PEBB retiree coverage, You will need to provide dependent verification documents. You can, of course, call our retiree specialist back at the office and just verify whether or not you need to supply those documents. But just to be safe, I would highly suggest that you go ahead with your enrollment form and supply the required dependent verification. So usually what's used to verify a dependent, a spouse or a child, is the most recent year's tax form, or we can accept a marriage certificate with some supporting documentation, or a birth certificate for your children. There is a list of what you can supply to us available on our website and in the enrollment guide as well. So what happens if the eligible PEBB retiree were to pass away? Well, we do have a surviving dependent rule here, and so for eligible surviving spouses, they may continue the PEBB retiree coverage indefinitely, so long as they continue to pay the premiums, and so long as, if eligible, that spouse maintains their enrollment in Medicare Parts A and B. For children, they may continue this coverage until they lose eligibility. So, for example, if a dependent child were to pick up the survivorship coverage, then they could continue that until the month in which they turn age 26. And of course, they must still pay the monthly premiums. Now, if the retiree, the PEBB eligible retiree, were to pass away, that surviving spouse or dependent has that 60-day window to notify PEBB of the retiree's passing and to either submit the enrollment form to either enroll or defer in this coverage. So they still have to contact us and let us know what's going on. Okay, so a little bit more detail on the actual medical plans themselves here. So the first section we're going to cover is specific to those retirees who are not entitled to Medicare. So generally speaking, people are eligible for Medicare when they turn 65. Some are eligible before that in certain circumstances, but the majority of people become eligible for Medicare at age 65. This section is talking about people who are not yet eligible for Medicare. You're either not 65 or you have not become eligible for Medicare at this point. So we do have medical plan options for you. Let's take a look. So we do have Kaiser Permanente Washington and Kaiser Permanente Northwest plans, as well as the Uniform Medical Plan. So with the Kaiser plans, those networks are going to be available primarily within the state of Washington. With the Uniform Medical Plan, this has the Regents Blue Shield network, and this has coverage available nationwide and worldwide for the most part, unless you were to enroll in some of our more the plans that have the reduced provider networks, which we'll cover that here in just a few minutes. But for the most part, Uniform has nation and worldwide coverage available under those plans. Kaiser available primarily within the state of Washington. So what do these plans cover? They cover all of the same basic healthcare services. So we have hearing, vision, prescription drugs, ambulance, preventive care, spinal manipulations. All of these things are built in. We also have office visits, hospital services. So it's a comprehensive health plan available to you. Let's take a look at the costs now. What are those monthly premiums? So I'm going to start at the top here. We're looking at Kaiser Permanente Northwest Classic and the Northwest CDHP, or High Deductible Plan. With the Northwest plans, Kaiser Permanente Northwest, those are available primarily in the southwesternmost part of Washington state. So we're talking Vancouver area. And then we have Kaiser Permanente Washington Classic, the CDHP or High Deductible Plan, the Kaiser Sound Choice Plan, and Kaiser Value Plans. So which one you can enroll in will, of course, depend on your county of residence. But with the Kaiser Permanente Northwest and Washington Classic and CDHP plans, those are going to have your broadest network within the Kaiser plans. Once you start going to the Sound Choice or the Value and you look into them, you'll notice that they do have a bit of a reduced network. Now let's take a look at the Uniform Medical Plan Classic. The UMP Classic and UMP CDHP, or High Deductible Plan, those are going to have the biggest network under the Uniform Medical Plan options. Now, if you are interested in the Uniform Medical Plus plan, or the Uniform, there's two of them. There's a Puget Sound High Value Network plan and a UW Medicine Accountable Network plan. Both of those are reduced networks, so great coverages. They still cover the same basic services. You're just not going to have as many providers available to you. Now, for a subscriber only per month, these plans range from $608 all the way up to $752.15 per month. Now, if you're adding a spouse, you can double that monthly premium. If you are a subscriber with children only, so no spouse added to your coverage, or a subscriber, spouse, and children, then you can see your costs increase a bit more as well. Keep in mind that these rates are available both in the 2020 PEBB Enrollment Guide for retirees and on our retiree section of our website. I also want to mention that for those of you who are currently enrolled in PEBB employee benefits, these are the same health plans that are available to you today as an employee. For those of you under the SEB program, those school employees, these are going to be different plans than what you're used to today. The SEB program does have Kaiser plans, and it does have Uniform Medical Plan, but they are different plans. So it's very important that you do your research and find a plan here that is going to provide you with the provider network that you are looking for. All right, let's talk a little bit about premium surcharge attestations. This section also applies to those non-Medicare members. My apologies for the delay there. I had to stop the recording for a moment. All right, premium surcharges. So there are two of them. Again, this is for non-Medicare members. So today, as active employees, whether you're in the PEBB program or the SEB program, we do have the tobacco premium surcharge attestation, and we have the spousal or state registered domestic partner premium surcharge attestation. So if the tobacco surcharge were to apply to you, that would be an additional $25 per month. If the spousal or state registered domestic partner premium surcharge applied to you, that would be an additional $50 per month. These are the same surcharges. We had to answer these questions as employees as well. Some of us have to reattest every year. If you're non-Medicare and you come on to PEBB retiree coverage, these still apply. Now let's take a look at the coverage options for retirees who are entitled to Medicare. So you are age 65 and enrolled in Medicare Parts A and B. We'll get to that here in a second. Or you're eligible for Medicare for another reason. So keep in mind, in order to be eligible for and enrolled in PEBB retiree coverage, on top of the eligibility criteria that I talked about earlier, if you are eligible for Medicare, you must be enrolled in Medicare Parts A and Part B in order to maintain your enrollment in PEBB Retiree Health Insurance. So Medicare Parts A, for the most part, does not have a premium because you've likely paid into that the entire time you've been employed, and there are some requirements that Medicare will outline surrounding Part A, but the majority of people do not have a premium associated with Part A. Again, you've paid into that during employment. However, Medicare Part B does have a premium associated with it, and it starts this year at $144 and upwards. And every year we've seen that increase just a little bit. Now, when I say it starts at $144 and upwards, that depends on your annual income each year. So your annual income will determine how much your Medicare Part B premium will be. Now, I am not a Medicare specialist. I just want to mention that it is very important that you be aware that you will be required to be enrolled in Medicare Parts A and B, and that you understand that Part B has a premium. Now you'll be paying that premium directly to the Social Security Administration. So that's totally separate from PEBB retiree benefits when it comes to where you're paying that premium. Also, we must receive a copy of your Medicare card showing that you are enrolled in Parts A and B. If you have a spouse or any dependents that are also enrolled with you, we must also receive their card showing that they are enrolled in Medicare Parts A and B as well. So what plans are available for those who are eligible for Medicare? Well, under the PEBB Retiree Health Insurance Program, we have Kaiser Permanente Washington and Kaiser Permanente Northwest, the same types of plans I talked about earlier. We have the Uniform Medical Plan, and we have the Premera Blue Cross Supplement Plan G over here on the right-hand side of the screen. Now we're going to focus on the first two sets of plans first, and then we'll talk about the supplement plan here in a little bit. With Kaiser Permanente, that is still a plan that is going to have a provider network that is primarily available within the state of Washington. So if you're sticking around Washington, not planning to do a ton of travel, you're not doing the snowbird thing, this may be a really good option for you. But if you're planning to move out of state, or you want to do a lot of international travel, or maybe you'll be going back and forth quite often, you may want to consider the Uniform Medical Plan because it has nation and worldwide coverage. So what do these plans cover? This slide might look familiar to you. These plans cover the same basic healthcare coverages as the non-Medicare ones do, the same types of coverages that our health plans today cover for us. The difference is that Medicare becomes primary. So remember, you have to be enrolled in Medicare Parts A and B. They are going to pay out for your benefits, and these plans are going to work with Medicare and pay a portion of your benefits as well, but Medicare is primary. So for the Kaiser and the Uniform, those plans cover things like hearing, vision, prescription drugs, very important, spinal manipulations, physical therapy, hospital services, office visits. Now let's take a look at some of those costs. What are those monthly premiums? So you can see here that we have the Kaiser Northwest Senior Advantage on the very top left-hand side of the screen. That premium per month for a subscriber only who is eligible and enrolled in Medicare Parts A and B, the premium you would pay to the healthcare authority would be $173.91. Again, this does not include Medicare Part B premium. You would pay that premium to the Social Security Administration. And then toward the middle of the screen here, we have Kaiser Washington Medicare Plan, $174.55. And we also have at the bottom the Uniform Medical Plan Classic, $320.54 for a subscriber only. Excuse me. Now, if you are adding a spouse with you and only one of you is eligible for Medicare, then your premium is going to increase quite a bit because one of you will be on the Medicare rate and the other will be on the non-Medicare rate. So you can see that those costs jump up quite a bit. Now, once you both become eligible for Medicare, I'm looking at the right-hand side of the screen here. For Kaiser Washington Medicare there in the middle, for a subscriber and spouse, both enrolled in Medicare, we have $344.04. Or for that Uniform Medical Plan Classic, remember it's the big nation and worldwide network, you have $636.02 per month. And if you're adding dependent children, those rates do increase, of course. I'll give you a moment to look at those. While you're taking a look at this, I do want to point out that while you do see the Kaiser Washington Classic plan, the sound choice and the value on this page, those would be for if you were enrolling somebody who was not eligible for Medicare. Keep in mind, if you are eligible for Medicare, those plans, those three, the Classic, sound choice, and value, will not be available to you. All right, again, these premiums can be found in the 2020 PEBB Retiree Enrollment Guide. and they're also available online on our website. So we covered a little bit of information about the Kaiser and the uniform plans. Let's go ahead and talk about the Premera Blue Cross Supplement Plan G now. This plan has nationwide coverage, and I do want to clarify that this supplement plan is a part of the PEBB program, okay? It's very important to remember that this is a part of our program. Let's take a look at that plan. So the Premera Blue Cross Medicare Supplement Plan G includes coverages for hospitalization, medical expenses, skilled nursing facility care, hospice care. So the way you're going to look at this plan is if Medicare is going to say, yes, that is a covered medical expense, we will pay our portion for that. They're going to come in and generally pay about 80% of whatever that service is. This plan will come in and pay the other 20%. But let's take a look at what the plan doesn't cover. So the Premera Blue Cross Medicare Supplement Plan G does not cover hearing, vision, alternative cares, or prescription drugs. The prescriptions are a pretty big deal, and this is the one that we get the most questions on. So remember that if Medicare does not cover something, neither does this plan. While Medicare does not cover prescription drugs, so neither does this plan. Well, how will you get that prescription drug coverage? You would need to go out onto the open market and enroll in a Medicare Part D for prescription drugs plan. Those plans can start as low as about $10, $15 per month, but if you have a lot of prescriptions or a lot of very expensive prescriptions, you definitely want to take a lot of care in selecting your plan and ensuring that if you go with this option, that you're not going to end up paying a lot out of pocket for those prescriptions. I will give you a resource toward the end of this presentation for SHEBA representatives who can assist you in doing that prescription search online. Medicare actually has a really great tool where you can go to their website, you can put in the prescriptions that you have, and they will suggest a Medicare Part D plan for you based on that information that you provide, and it'll tell you how much it's going to cost you as well. Keep in mind that the Premera Blue Cross Supplement Plan G through PEBB, that is the only plan that you will need a Medicare Part D plan for. The Kaiser and the uniform plans do include prescription drug coverage, but the supplement plan does not. All right, so how much does it cost? Well, I'm looking at the Plan G, age 65 plus, eligible by age column there. One Medicare eligible, just a subscriber only, $97.56. And again, this plan is nationwide coverage, but you do have to get that Medicare Part D prescription drug plan. So just remember that. Now, if you're adding a spouse onto your coverage with you, but only one of you is eligible for Medicare, your premium is going to jump back up because one of you is paying the Medicare rate and the other is paying the non-Medicare rate. And the person who is non-Medicare will actually be enrolled in the Uniform Medical Plan Classic. So if you were to compare this $772.22, it's going to be a pretty similar figure to if you were to include this $97.56 for the one Medicare eligible with that non-Medicare rate for the Uniform Medical Plan Classic. But when both of you become eligible for Medicare, you enroll in your Medicare Parts A and B, and you give us proof that you have those cards showing that you're enrolled. I'm going to look over here toward the far right side where it says to Medicare eligible. Then your premium drops back down to $190.06. And if you're adding dependent children, of course, those premiums per month do increase as well. So you may have some questions right now about how exactly does Medicare work with these plans? Well, each of the plans is a little bit different, and there is a lot of information available for you on our website. So if you're comfortable with going out to our website, you can access that by visiting the link I provided earlier. the hca.wa.gov/PEBB. And once you come to this page and you click on retirees, there's going to be an in this section toward the middle of the page, and at the very bottom it says Medicare and PEBB program benefits. When you click on that, it has, oh gosh, about 10 sections here of information that talk all about how the plans coordinate with Medicare. You can also, of course, call our specialist back at the office, and I'll be providing that phone number for you here in a little bit again. Okay, let's talk about dental insurance. So dental insurance is offered through PEBB Retiree coverage. It's not a requirement that you enroll in it, but it's available to you. There are a couple of things to know. So regardless of whether you are enrolled in the PEBB or SEB program, we all have the same dental plans available to us. We have Delta Care, Willamette Dental, and Uniform Dental Plan. And I'm talking about us as employees. But PEBB Retiree coverage also offers those same 3 dental plans. So whether you're a retiring PEBB employee or a retiring SEB employee, if you come on to PEBB Retiree coverage, these are still your dental options. So you can stay with your same dental plan if you choose to, but you're not required to enroll in dental. Now here's a few things to know. If you were to enroll in our PEBB Retiree medical coverage and then you wanted to elect dental as well, you must enroll all of your dependents who are also enrolled in your PEBB Retiree coverage. So if I'm coming on board and I'm going to enroll my spouse in my retiree coverage and maybe one of my children, and I decide I want dental for myself, they also have to be enrolled in dental coverage. And I must maintain that dental coverage for at least 2 consecutive years. During that time frame, I can change my dental plan every month if I choose to, but I can't waive that dental coverage until I've had it for 2 consecutive years. Now, a common question that I get is, well, what if I don't want the dental coverage right now? You don't have to take it right now. You can wait until next annual open enrollment if you would like to wait in and elect it at that point. You could wait 2 or 3 years down the line, and then you could elect the coverage during annual open enrollment. But once you've elected it, you have to have it for 2 consecutive years before you can waive. Another question that I get is, well, if we enroll in the coverage and then we decide to waive after 2 years, and then maybe a year or 2 goes by and we decide we want the coverage back, can we enroll again? Yes, you absolutely can. Even if you waive it, you can still come back during next annual open enrollment. The same rules do apply. You must still have it for then 2 consecutive years, and anybody enrolled into your account must also be enrolled in your dental. Now, one difference between our dental coverages today, between our dental plans today as employees versus with PEBB Retiree coverage is that currently we don't have a dental premium. But on PEBB Retiree coverage, your employer is no longer paying that for you, so you do have to pay a premium if you decide to elect this coverage. For subscriber only, your cost per month for that premium is going to range from $39.53 to $47.01. Now, if you're adding a if you're adding a spouse along with you, you'll have to double that premium. And then, of course, adding children and a spouse will increase that even more. And again, these premiums are available on our website and in the enrollment guide. So here's just a little bit of information for you. One of our major appeals that we receive is regarding dental plan election between Uniform Dental Plan and Delta Care. So you've probably heard of Delta Dental. It's this big network, and we see their signs all over the place. Well, Delta Dental administers both of these dental plans. They administer both Uniform Dental and our Delta Care plan. Uniform Dental is our big Delta Dental network, any licensed dentist worldwide. Delta Care, however, is a managed care network. It's a much smaller network. So do take care when making your dental election. Definitely give the plan, the actual dental plan, a call to talk with them about their provider network. Please don't call your dentist and ask them if they're in network for one of these plans, because many times all they will hear is Delta Dental and they'll just say yes, and that might not be the correct information. So we highly suggest that you call the plans, and their phone numbers are listed here on the slide right now for you. Okay, let's talk a bit about the life insurance option. So if you are currently enrolled in PEBB or SEB life insurance as an employee, you have a few options for you once you retire in order to continue that life insurance or to elect life insurance. So if you'd like to continue the life insurance that you have today, you have the option of porting to an individual term life insurance policy or converting to a whole life insurance policy. But those two options are going to happen directly with MetLife. That's something you would talk with MetLife about. Here's their phone number on the screen for you. And you could talk with them about what are your options and how much is it going to cost you? Because if you decide to go to an individual policy, your premiums are going to be quite a bit higher than they are today with the PEBB or SEB group. Now, through PEBB Retiree Insurance, we have this third option here for you. It's PEBB Retiree Group Term Life Insurance. And keep in mind that you do have that 60-day window to elect this coverage, but you can only cover yourself as the retiree. You will not be able to enroll and cover your spouse or dependents under the PEBB Retiree Group Term Life Insurance. However, with the portability or conversion, you may have those options. So that might be a reason you'd want to reach out to MetLife. If you would like to contact them to talk with them about this, their phone number is 1-866-548-7139. Now let's talk a little bit about enrolling and your premium payment options. So first things here, this one's about enrollment. So in order to enroll, you may want to request the Retiree Enrollment Guide. Now we suggest that you go ahead and contact us no later than 60 days before you're going to be separating employment to request this guide. It can take a little bit of time to generate that mailing. Now, keep in mind that you can actually contact us January 1 of that plan year and request that we mail you out a guide for that year, every year. So for those of you who are retiring in 2020, you can give us a call and ask that they mail you out those guides immediately. Now, keep in mind, some of those services might be a little bit off with the current events and the coronavirus occurrence right now, but this is an option for you. If you are retiring in 2021, you'll want to wait until January of next year because the 2020 guide is not going to be what you will need. It doesn't have the correct enrollment forms in there for you if you're retiring later. Now you can also find this guide in PDF format on that website that I keep referencing. So if you don't want to wait for a mailing, you're not worried about receiving a paper version, you can go right online to our website and find the enrollment guide and all of those enrollment forms as well. And you can fill them out online and print them off. If you would like to request the guide, our phone number is listed here for you. So 1-800-200-1004, and that will get you to a PEBB retiree specialist. Now, while we're on this slide, I do want to mention that you can submit your enrollment forms to us early. So we suggest no earlier than 90 days before you're going to be separating employment or your insurance coverage with your employer is going to end, but of course, no later than 60 days after your insurance coverage ends. So it's definitely okay to be ahead of the game and submit your forms a bit early. In order to enroll dependents, you are required to supply that dependent verification, okay? So those are those documents to verify your dependents if you're adding them to coverage. So that's if you're adding any eligible dependent. So the best thing to do is to supply that with your enrollment form. Also, as a reminder, for yourself or anybody else who will be enrolled in your PEBB retiree coverage, we really need a copy of that Medicare Part A and B card. And again, it is just a copy. We don't actually want you to send us your card. You need to keep that. So we need a copy for everybody who's eligible for and enrolled in Medicare Parts A and B. That way we know to reduce your premium. For those of you who may continue working past the age of 65, I'm going to kind of switch gears here real quick. If you're not going to retire before age 65, you're going to continue working. A common question that we get is, well, I know I'm eligible for Medicare at 65, but do I need to do anything with it? And the answer is, yeah, you need to do something. So we suggest you enroll in Medicare Part A. Just go ahead and do it. There's usually no premium associated with it because you've already been working and paying into your Social Security benefits the entire time you've been employed. You can, of course, talk with Social Security to determine whether or not there will be a premium for you for your Part A. But we suggest that you hold off on enrolling in your Part B for Medicare. So B as in boy. Because Part B will likely not pay out a benefit to you while you're actively employed and enrolled in employer benefits. So while you're still working and you have employer coverage, that coverage is going to be primary for you, and you're paying a premium for it too. So why pay your employee premium and your Medicare Part B premium as well if that Medicare Part B is not going to pay anything? So you can definitely put that Part B on hold. Now, when you do separate employment and your coverage with your employer ends, you will have a window in which you will be allowed to go ahead and enroll in your Part B. Social Security is going to ask that you complete your application for that coverage and that you have your employer fill out a form saying that you've had continuous coverage for that entire time from the date you turned 65 to when you ended employment. So that's what you'll need to submit to them. And I will provide you with contact information for Social Security in case you have any questions on that. This is just a reminder that those enrollment forms and required documentation, again, they must be received by the PEBB program. We need them no later than 60 days after your coverage ends with your employer. Your first premium payment is due a little bit later. We suggest you go ahead and send all of it together, but you do have up to 45 days after we receive your enrollment form. So the only exception to this is if you're going to be electing for a pension deduction, but we haven't talked quite yet about how you can pay your premium. So we'll get to that here in just a second. Now, if you are going to be retiring within the next 6 months or so, right now is definitely when you should be contacting your Washington state-sponsored retirement plan. So sometimes people will reach out a year and a half early. That's great. We suggest that you reach out to them no later than 6 months prior to your separation date. That way you can talk with them about whether or not you're eligible, or, is there anything that you need to know? How much is your pension going to be? That sort of thing. That way you can plan for this. Unfortunately, we have heard before of people talking to coworkers or hearing, information and assuming that they're eligible to retire. And then they put in their notice at work and they resign and they send their application to us, and it turns out that they weren't eligible and they really should have contacted their retirement systems plan. So don't let that be you. Reach out to the Department of Retirement Systems if they are the ones who administer your retirement plan, or to whoever administers your retirement plan to touch base with them. Know that DRS, the Department of Retirement Systems, they do have learning tools, so seminars and webinars available for you on their website. So you can go onto their website and you can attend those to start learning about what you might need to know before retirement. Okay, let's look at your premium payment options. So you can elect for a pension deduction if you're going to be drawing your pension, of course. Remember, those of you who are plans 1 and 2 are required to draw your pension. Those of you under plan 3, not required, but you still must be eligible to do so. You also have the option of automatic bank withdrawal, so you can just pay it directly out of your checking automatically every month. Or you can elect for a monthly invoice. This is the third section where you would pay us a personal check or money order each month. Now, that is an option for you, but if you're doing a lot of traveling or maybe you're not really sure where you're going to be at from month to month, receiving an invoice and sending us a personal check or money order may not be the best option because you really don't want to miss making your payments. You also have the option for PEBB reimbursement. So we get a lot of questions surrounding PEBB. I'm not going to go into exactly what it is because it's a little bit different for every organization, but know that if you have a PEBB balance, you can use those funds to reimburse yourself, but you cannot use them to pay for your PEBB retiree health benefits directly. People will ask, can I do an automatic payment from my PEBB account? And the answer is no. You must pay us directly through one of the first three methods, and then you can contact PEBB and you can set up that reimbursement program. You can even set up an automatic monthly reimbursement so that you're not constantly having to communicate that to them as well. But do talk with your benefits administrator at your workplace about your PEBB options, and they will be able to provide you with more information. Okay, let's cover making changes. So when can you make changes? What options do you have for that? I'm going to go back one slide. A lot of times people will get a little bit concerned about the plan options, and the concern is, am I making the right decision for myself? It is very hard to choose which medical plan to go with, especially for those who are transitioning from the SEB program or previously groups that transferred into PEBB retiree coverage that had outside insurance, because for some of you, these are brand new health plans and it's a very stressful decision. But keep in mind that just because you select a certain health plan, it does not mean that you're locked in. So every annual open enrollment during the month of November, you can elect to change your health plan. So you can go from Kaiser to Uniform to the Premera supplement plan. Every year you can change it if you choose to, as long as the plan you're electing is available to you in your county of residence. Now, annual open enrollment is the entire month of November, so we have to receive your change no later than November 30th, and those changes will go into effect January 1st. So during that time, you can elect to change your medical or your dental plans. You can enroll in dental during annual open enrollment, but if you've had dental for 2 consecutive years, you can choose to waive dental. And you can even enroll or remove your spouse and dependents. Another question that we get is, well, what if I become eligible for Medicare in the middle of the year? Or what if I move somewhere in the middle of the year? Those trigger special open enrollment events. That's a qualifying event that allows you to make certain changes. It does depend on what the event is as to what changes you can make. That's how that's determined. But know that if you experience a marriage, a divorce or dissolution, maybe you get a Washington State registered domestic partnership, you become entitled to Medicare, you change addresses, you have a baby, any of those things will create this special open enrollment event that allows you to make changes. But what's very important to know is that you only have a 60-day window. That's it. So when your event occurs, you need to contact us and get your changes submitted within that 60-day window. Otherwise, you have to wait until annual open enrollment. Certain changes can take place at any time. For example, you can remove dependents at any time throughout the year. And another tidbit here is that if you were to experience a divorce or dissolution of partnership, it is required by law that you actually remove them from your coverage because they're no longer eligible to be on your PEBB retiree benefits as a spouse if you experience a divorce or dissolution of partnership. Okay, so who to contact? If you have questions about how the medical plans work, or if you end up having questions about claims, prescriptions, health provider network, that sort of thing, you always want to reach out to your health plan directly. Their phone numbers are available in the enrollment guide on our website, and once you're enrolled, you'll have that phone number listed on the back of your benefits card as well. If you have questions about Medicare, you can call Medicare at 800-633-4227. But for Medicare enrollment, you'll want to contact the Social Security Administration. Their phone number is 800-772-1213. And here's a resource that I was talking about earlier that I really wanted to provide to you. Some of you may have heard of SHEBA before, but SHEBA stands for the Statewide Health Insurance Benefits Advisors. Their phone number is listed here. It is 800-562-6900. So why might I want you to write that down, or why might you want to be writing this down? Well, the Statewide Health Insurance Benefits Advisors are volunteers who work for the Office of Insurance Commissioner. They can provide free, unbiased information about plans on the open market. So since we're talking about that right now, I do want to touch this subject a little bit. You have the option to enroll in PEBB retiree coverage as long as you meet the eligibility criteria that we talked about earlier. But know that there are plans on the open market that are available to you. When you turn 65 or you're getting close to it, you're going to get all kinds of information on those plans. And those are an option. SHEBA can talk with you about those plans on the open market. SHEBA can also talk with you about that Medicare Part D prescription drug plan, and they can assist you with your Medicare Parts A and B enrollment. Now, I keep talking about open market, but here's something that you really need to know. If you were to elect a Medicare plan on the open market instead of a PEBB retiree plan, then you will lose your opportunity for PEBB retiree coverage. Okay, so you cannot go out to the open market to get a medical plan and then come back to us. We talked about deferring earlier and which plans you could defer for. Open market plans were not one of them. Now we have the Kaiser, Uniform, and Premera supplement plans for those who are eligible for Medicare. You can bounce back and forth within the PEBB program every annual open enrollment and not lose your eligibility to be in the program. But if one year you decide to leave and go to the open market, that's when you're going to experience that issue where you cannot return. The only way to regain eligibility for PEBB retiree benefits, if you were to leave the program, would be to go back to work and regain your eligibility. Okay. So I went off on a little bit of a tangent there, but it's important to mention that. SHEBA can help you with information on those plans on the open market or that Medicare Part D prescription drug plan that you would need if you elected our Premera Supplement Plan G. SHEBA is not equipped to help you with your PEBB retiree benefits questions, so please don't call SHEBA about PEBB retiree benefits, okay? If you have questions about PEBB retiree benefits, you'll want to call the PEBB Customer Service Retiree Specialists. Their number is listed here, 1-800-200-1004. They're going to be able to answer questions about eligibility, enrollment, those monthly premiums, and answer any questions that you may have about your existing account when it comes to your existing retiree account. Now keep in mind, as active employees today, we have to go to our benefits administrators or to our benefits office to talk with them about our current benefits. This phone number is specific to PEBB retiree, but you can also call them about COBRA coverage as well. One last thing I would like to mention is that the healthcare authority has closed their lobby for the time being. So until future notice, starting March 18th, the lobby has been closed. So you cannot at this time come to our offices and sit down face to face with somebody, unfortunately. Previously, you could bring your forms in, bring your payment in, no problem. But right now, due to the coronavirus, we ask that you send your forms and any other documents that you're going to be mailing in, of course, via the mail rather than bringing them in, and also that you call our phone number if you have questions rather than coming into the office. If you were to visit the website that I referenced earlier, our PEBB website, there is this yellow bar, if you can see that across the middle of the screen here. If you click on Learn More, the blue hyperlink, I've also provided that link here at the bottom of this slide. That will give you more information about the impact of having our lobby closed and what you might need to know. All right, and that's all I've got for you guys. I hope you have a fabulous week. Enjoy the sunshine that we have right now anyways. And thank you.